This is your personal protective envelope for dealing with communicable diseases. Keep in mind this is a work in progress as the CDC is continuing to review materials. This package was distributed to all stations, containing some booties to go over your shoes, a gown that is somewhat impermeable, eye protection, along with an N95 mask, gloves, 2 pairs of different size gloves, and a hand sanitizer that you can use. A biohazard container to put all the waste material in. While donning your PPE, remember, check your partner. Check each other as you get dressed. Initially, when you start, you want to put the booties on, the gown, the mask, eye protection, and the gloves. We'll talk about each one of them as we go along here individually. First of all, the booties. These are difficult to get on over top of your shoes. Prior to putting them on, make sure that your shoes are tied tightly, because when you go to take your booties off, you may pull your shoes off. Work them up over top of your shoes little by little, extending them as far as they'll go, making sure that they fit somewhat snugly and that your uniform trousers are inside of the booties. The next thing that you'll put on will be your gown. Unfold the gown and try to find each of the sleeves, putting your arm through one sleeve at a time. As you get the sleeves pulled up, you'll notice that at the end there is a wristlet similar to your structural firefighting gear. Your thumb obviously goes in through the smaller hole. Your 4 fingers come through the larger hole, slide it over top of your head, and then tie the gown behind you. Again, you can assist each other by tying the gown. N95 mask will be next. Again, unfold the N95 mask. Place it over top of your nose and mouth. Pull the bottom down to ensure that your chin is seated inside the mask itself. And then one strap should be high on your head. The other strap should be low on your head over your ear, because if it's below your ear, the mask may become loose and fall away. Again, bend the top of the mask to ensure that it fits snugly over top of your nose. If you have glasses, place the goggles over top of your glasses. Slide the goggles over top of your head, pull them down over your eyes, and then pull the straps on the side so that they will fit snugly over top of your face. Don your gloves, 1 pair at a time, over top of the gown, ensuring that the glove cuff comes up over top of the gown, so that there is no space in between the glove and the gown. Hopefully the wristlets will help pull the gown down and keep it underneath your glove. Once everything is tucked up inside, you're then able to move to placing your second pair of gloves over top of the first pair of gloves. Again, check each other, ensuring that everything is covered. The second pair of gloves that you're going to use when you double glove should be a size larger than the first pair that you put on. So if there's not one inside the package that you got of protective equipment, make sure that you have a second pair available to you that's, again, at least one size larger than the gloves that you used. Again, make sure, just like your first pair of gloves, make sure the second pair of gloves completely covers the gown so that there is no space between your glove and the gown. Once you've completed the transport of your patient, You then need to remove your PPE. The sequence is going to be remove the boots, the gloves, sanitize your hands if needed, eye protection, the N95 mask, the gown, and then again sanitize your hands. The booties, simply pull them off inside out. Place them into the large red bag. The gloves, pull at the wrist so that the glove unfolds off of your hand. Try to be careful so that you don't touch any part of the gown as you pull your gloves off. Again, they go into the red bag. Untie or just simply pull apart the knot from the back of your gown, slide it over top of your head, pull it inside out over top of your uniform shirt. The goggles, you want to pull the strap up over top of your head, let the goggles fall away from your face, drop them in the bag. Removing your mask, take the bottom strip off first, then the top, again letting it fall away from your face into the red bag. You then can sanitize your hands using the alcohol-based solution that was supplied in the bag. And as a final, wash your hands preferably with soap and water in a sink. Lather, as it says here, for about 10 to 15 seconds. It's been recommended sometimes that you sing quietly to yourself the happy birthday song. Some of us should sing quieter than others. But again, 15 seconds of lather, rinse your hands, and then utilize disposable paper towels to dry your hands and turn off the water using the paper towel. Since you have hopefully turned on the water with the paper towel and turned it off with the paper towel, you have not risked contamination of your hands.
For additional information, please contact the on-duty safety officer or one of the on-duty EMS duty officers.